Welcome. In this video, we'll explore a neurological condition called Chiari Malformation. We'll delve into what it is, its causes, symptoms, diagnosis, and available treatments. Understanding this condition is crucial for those affected and their families. Chiari malformation isn't caused by a single factor, but rather a complex interplay of genetic and environmental influences. In many cases, it's considered a congenital condition, meaning it's present at birth, often arising during fetal development. This can be due to genetic mutations affecting the size and shape of the skull or brain. In other instances, Chiari malformation can develop later in life, acquired through trauma, infection, or tumors that increase pressure within the skull. The core problem in Chiari malformation is a structural defect in the base of the skull and the cerebellum, the part of the brain responsible for balance and coordination. Specifically, the cerebellum, or parts of it like the cerebellar tonsils, descends through the foramen magnum, the opening at the base of the skull where the spinal cord connects to the brain. This descent puts pressure on the brainstem and spinal cord, disrupting the normal flow of cerebrospinal fluid, or CSF. CF cushions the brain and spinal cord, removing waste. The blockage of CSF flow can lead to a build-up of fluid in the brain or spinal cord, causing further complications. While precise figures are difficult to obtain, Chiari malformation is estimated to affect about 1 in every 1,000 births. It's important to note that many people with Chiari malformation may remain asymptomatic or have symptoms so mild they go undiagnosed. Advances in imaging techniques like MRI have led to increased detection rates. Chiari malformation can affect individuals of all ages, genders, and ethnicities. The symptoms of Chiari malformation are varied and depend on the severity of the condition and the specific structures affected. Common symptoms include headaches, often described as occurring after coughing, sneezing, or straining, neck pain, dizziness, balance problems, muscle weakness, numbness or tingling in the hands and feet, difficulty swallowing, and speech problems are also frequently reported. In more severe cases, paralysis, breathing difficulties, or hydrocephalus, an excessive accumulation of CSF in the brain, can occur. Some individuals may also experience scoliosis, a curvature of the spine. Diagnosing Chiari malformation typically involves a thorough neurological examination followed by imaging studies. Magnetic resonance imaging, or MRI, is the gold standard for visualizing the brain and spinal cord. It allows doctors to see the extent of the cerebellar tonsillar descent and any associated abnormalities. A CT scan may be used in some cases, but it provides less detailed images than an MRI. A neurological exam can assess reflexes, coordination, and sensory function, further aiding in diagnosis. Chiari malformations are broadly classified into several types, primarily based on the degree of cerebellar descent and associated abnormalities. Type 1 is the most common, involving only the descent of the cerebellar tonsils. Type 2, also known as Arnold Chiari malformation, is typically more severe and involves the descent of the cerebellar vermis, as well as parts of the brainstem. Type 3 is a rare and very severe form with herniation of the cerebellum and brainstem through a defect in the skull. Type 4 involves cerebellar hypoplasia or underdevelopment. Type ZAR is a less common, controversial classification characterized by symptoms consistent with Chiari malformation without significant cerebellar tonsillar descent on imaging. Treatment for Chiari malformation depends on the severity of symptoms. For asymptomatic individuals or those with mild symptoms, observation and conservative management may be sufficient. This involves regular monitoring and symptom management with pain relievers or physical therapy. For more severe cases, surgical intervention may be necessary. The most common surgery is posterior fossa decompression, which involves removing a small portion of the bone at the base of the skull to create more space for the cerebellum and reduce pressure on the brainstem and spinal cord. In some cases, the dura, the membrane covering the brain, may be opened and a patch graft inserted to further expand the space. A shunt may be required to drain excess CSF in cases of hydrocephalus. Unfortunately, there's no known way to directly prevent Chiari malformation, especially since many cases are congenital. However, optimizing maternal health during pregnancy, including adequate folic acid intake and avoiding harmful substances like alcohol and tobacco, may reduce the risk of certain birth defects. Avoiding head trauma later in life can help prevent acquired Chiari malformation. The prognosis for individuals with Chiari malformation varies widely depending on the type and severity of the condition, as well as the presence of other associated abnormalities. Many people with mild cases can live normal, productive lives with minimal intervention. For those requiring surgery, the outcome is generally positive, with most experiencing significant symptom relief. However, some individuals may experience persistent symptoms or complications. Recent research focuses on improving surgical techniques, understanding the genetic basis of Chiari malformation, and developing non-invasive treatments. Further research into the long-term effects of Chiari malformation and its impact on quality of life is also underway. By understanding this condition better, we can work towards improving the lives of those affected.